Hello, this is the first lecture of the medical terminology course. These PowerPoints go along with your textbook Essential of Medical Language by McGraw-Hill. For our very first lecture, we will just be going over the anatomy of word construction. After this lecture, you should be able to identify the roots, combining vowels, and combining forms of medical terms. You should also be able to understand the importance of suffixes and prefixes in forming medical terms. You should be able to link word elements together to construct medical terms, break down or deconstruct a medical term into its elements, connect the singular and plural forms of medical terms, and verbalize the pronunciation of medical terms by employing the system used in the textbook. So, roots and combining vowels. All medical terms have one or more roots. The root provides the meaning of the word. For example, the word pneumonia has the root pneumon, which means lung or air. Roots are often joined to other elements of a medical term by placing a combining vowel on the end of a root. A root plus a combining vowel creates a combining form. For example, pneum plus o is pneumo. Pneumo is a combining form. Combining forms are often shown with a slash. In this example, respire /a, respira is the combining form separated with a slash, respire referring to the lungs or air, and the a being the combining form, in which we will add a suffix later on. Remember, different roots can have the same meaning. Pulmon and pneumon both mean lung. Now, a suffix is an element added to the end of a root or a combining form, and it gives it a new meaning. If the suffix begins with a consonant, it must follow a combining vowel. For example, dermatologist. Dermat /o is the combining form, and logist is the suffix. If the suffix begins with a vowel, no combining vowel is needed. For example, dermatitis. The suffix itis begins with a vowel, so it does not need a combining vowel. Now let's break down some examples here. Pulmon is the root, airy is the suffix, pulmonary, pertaining to the lung. Now, pulmonology, pulmon being the root, o being the combining vowel, and logy being the suffix. Pulmonology, the study of the lung. Other common suffixes include ia, and ia is a condition of. Therefore, pneumonia is a condition of the lung. Ation is a process. Respiration is a process of breathing. Now, if we're talking about prefixes, a prefix is an element added to the beginning of a root or combining form to continue or expand the meaning of medical terms. Prefixes never require a combining vowel, but not every term has a prefix. Let's use the example of premature. Pre is the prefix and mature is the root. Premature stands for before the normal pregnancy. Then oppositely, if we're talking about the prefix of post and the root of mature, post-mature is after the normal pregnancy. Other prefixes you might have seen before include uni and bi. Unilateral, one side of the body. Bilateral, two or both sides of the body. Perinatal, around the time of birth. Peri is around. Epi is above. Epigastric is above the stomach. Hypo is below. Therefore, hypogastric is below the stomach. Micro is small. Microcyte is a small red blood cell. Macro is large. A macrocyte is a large red blood cell. Let's identify the prefixes and suffixes of the following word. Perinatal. Peri is the prefix. Peri means around. Nat is the root. All is the suffix. Perinatal is around the time of birth. Now let's break down hypogastric. Hypo is the prefix. Gast is the root. And ic is the suffix. When you see an unfamiliar medical term, you should first identify the suffix. For example, with cardiologist, the suffix is logist, which means the one who studies, or a specialist. And then cardi is a root which refers to the heart. O is the combining form. So cardio is the combining form for heart. And if we're talking about cardiologist, that is a specialist or one who studies the heart. Now, let's talk about myocardial. The suffix is al. The root is cardi. My refers to the muscle, and O is the combining form. So myo is the combining form for muscle. Therefore, myocardial means pertaining to the heart muscle. Let's review. Here we have cardi, we have O, we have myopathy, cardiomyopathy. Now, cardio is the combining form. Myo is also a combining form, with pathy being the suffix. Cardio refers to the heart. Myo refers to the muscle. Pathy refers to a disease or an illness. Therefore, cardiomyopathy is referring to an illness of the heart muscle. So, pronunciation of medical terms is extremely essential so that other health professionals can understand what you're saying. It is extremely important in ensuring patient safety and providing high-quality patient care. If you mispronounce something, if you tell your partner to go run a test for something that isn't what you meant, you could get in a lot of trouble and you could be risking your patient's life. Some words that are pronounced the same are spelled differently and have different meanings. For example, ilium and ilium are both spelled differently yet are pronounced the same. The ilium is a bone in the pelvis, where the ileum is a segment of the small intestine. So you see where you could go wrong here, where if you're trying to speak about a bone in the pelvis, but your partner thinks you're talking about a segment of the small intestine. Now, some words sound the same if you pronounce them incorrectly. For example, prostate. It's pronounced prostate, which is referring to the gland at the base of the male bladder, and the term prostrate, pronounced prostrate, means to be physically weak or exhausted, or to lie flat on the ground. Now, speaking about plurals. Plural endings for medical terms do not just simply involve adding an S. Plural endings must be memorized. This will be extremely important in your studies. Here's a reference table from the textbook with a singular ending, a plural ending, a. Axilla is plural, where axilla is plural. Axilla is singular, axilla is plural. Here we have a singular ending, is, and a plural ending, ease. Diagnosis is singular, where diagnoses is plural. Please note, many words, when they are written or pronounced, have an element that, if misspelled or mispronounced, gives the intended word an entirely different meaning. Consider this case. Hypotension, low blood pressure. With hypertension, high blood pressure. A treatment response to the different meaning could cause a medical error and perhaps the death of a patient. If your patient has hypertension and you start treating them for hypotension because you gave the wrong directions to somebody, they could possibly die. Also, please note that precision in written as well as verbal communication is essential to prevent errors in patient care. When you are writing, be clear. Make sure everything is spelled correctly and your writing is legible. In summary of this presentation, you should remember that being a health professional requires the utmost attention to detail and precision in both written and verbal documentation. A patient's life can and will be in your hands. Any incorrect spelling can reflect badly on the whole health team. Any incorrect pronunciation and spelling can reflect badly on you as a health professional. Roots provide the core meaning of medical terms. They are often joined to other elements in the medical term by placing combining vowels on the ends of roots. Adding a suffix or a prefix to a root can build new words with different meanings. Precision in communication is vitally important. Remember, when you're at work, be clear, be concise,